Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. We've been discussing a very important condition that's found mostly in African Americans, but other folks as well, but generally African Americans, called sickle cell anemia. And years ago, I got involved, at least 30 years now, with sickle cell patients, and I always admired the courage that they had to have to face the pains of this condition. Until recently, we had nothing other than painkillers sometimes. At that time, I wrote a song called A Black Child Who Can't Smile, because I treated many of the patients with sickle cell anemia. I went to their homes and so forth, formed an organization called the Sickle Cell Victims Organization, where we raised money, not so much for research, but to give it to patients who had a child with sickle cell anemia, so they could buy their medicine, so they could do vacations, so they could do a lot of things, go away on to camps and things like that. But the song, recorded by Brooke Benton at that time, and it had to be now 30 years ago, says, "Have you ever seen a black child who can't give you a smile because the pains in the joints are so great? The answer is easily found when you find his blood count down, because the cells that have sickled easily break. Now the child didn't ask for this when life gave him a kiss, that he would have to suffer such pain and woe. So come on, join the band, give this little black child a hand, and let his blood flow so he can grow and grow." Well, thank God, these sickle cell children are growing and growing. I mean, they're going to adulthood, they're getting married, they're getting all kinds of enjoyments out of life and with less pain and things like this. And pain is a terrible thing. I mean, you don't know what you're treating, where the pain is coming from. In sickle cell anemia, they will tell you it is severe pain. It'll stop you from going to school, it'll stop you from enjoying life in general. So we have to say thank God that research has proven to be able to give us a medication that can possibly give these sickle cell patients a normal life and not have the crisis. And so I want to introduce you to Dr. Scott Miller here. Dr. Miller, thanks for coming with us today, knowing your background here at Downstate Medical Center in Kings County Hospital. Just prior to discussing our further patient here, Ms. Yelverton, give just a little of your background as far as sickle cell anemia is concerned.
Well, this is my first job. I came here in 1981. I've been here ever since. And Downstate, when I came, had already established itself as a major place for both clinical care and clinical research. And I sort of tried to keep that tradition going as best we can. We've done a number of trials with other hospitals of various treatments for sickle cell disease, and made some observations and written about sickle cell disease. I guess in part because that's what was here, and that's what where the interest had been, and there was some support for that when I arrived, and so we've tried to continue what really was a very strong tradition of sickle cell care and research, back in the 70s.
Oh yes, well,
60s.
I see that you did a lot of worrying about sickle cell anemia. Like myself, your hair's getting gray.
Really?
And my hair has gotten gray, and I'm losing my hair. So I've been back there a long time, seeing you work here. When you came here, we all age ourselves. But in your experience of treating sickle cell anemia and the pain of sickle cell anemia and the early life of sickle cell patients, it must be a tremendous feeling for yourself that you have done something in your lifetime as a physician to see this come to pass.
Well, in one sense, it's gratifying to take care of people and get them better, and we do have some medication recently that helps with that. On the other hand, it's a little bit frustrating that we really don't have a cure for sickle cell disease yet, except for transplant. We talked about that a bit the last time. So, there are government programs that pay for research and sickle cell support, but there really are not very many compared to the funding that's available for research regarding some other diseases that, although uncommon like sickle cell is, they get a lot more attention and a lot more funding for some reason.
When you say for some reason, what do you think it is that we don't have? Genetic diseases now are just known all over the place. Why shouldn't sickle cell more money be given toward that research as such?
I think part of the problem is that many people with sickle cell disease are socioeconomically deprived. They may be poor. They may not be able to go to the best schools all the time. And they don't become wealthy maybe as frequently and don't have as much power to influence the lawmakers and the people who decide where research money should go. I hope I'm not sounding like a communist or something, and I don't mean to. But I think that that part of the problem is that sickle cell people have not been able to organize themselves and to get to lobby for the kind of support that other disease people may have.
Yeah, what you know about Howard University, Meharry, and those black medical schools, they certainly have seen sickle cell anemia. I know that it was difficult for them to even get funded to do further studies. And I've been in this field a long time to see the ravages of this anemia and so forth. And the mere fact that at the present time that we'll get into this new drug that possibly can help. Maybe you can explain what this new drug is doing and how it might change the focus on getting more money into your laboratory to do further studies.
The drug is basically helping reduce the pain of sickle cell disease and almost certainly extend the lifespan of people with sickle cell disease.
Right.
Pain is, the most common symptom of people with sickle cell. Tiara, I don't know if we haven't introduced her yet this session, but
well, maybe I'll do that right now,
okay,
Terry. Terry, you're here sitting here looking and laughing from the time you came into the thing. It doesn't look like you really have anything wrong other than a good smile, a smile a while. But how long have you had sickle, or when was you first discovered to have sickle cell anemia?
When did I just like?
When did your parents find out?
I believe my mom did a newborn screening.
A newborn screening.
Yeah.
And how long ago is that now?
I don't even know how long. I know I was like.
How old are you now?
18.
18. Okay. Well, you look well for 18. You look like. And at that time, was it any symptoms you were having?
I'm not really sure.
About pain
like
or something like
that, I don't know. I think like my mom did all this. I don't know exactly how she found out that I had it. I believe that she did a newborn screening and found out though.
Oh, I see.
Everybody gets newborn screening. In New York State since 1975, every baby born in a hospital, at least in New York State, gets screened for sickle cell disease. And for sickle cell trait, and that can be important in family planning, etc. A lot of us don't have resources to go out and find all the people with trait, get their parents in, see if they have trait, and really do good counseling.
Sure.
But if you are born in New York State, somebody knows your hemoglobin status at the Department of Health.
Well, I understand genetic diseases, almost like 20 of them, they can tell right away when their baby's born.
More than 20. I don't know the number now.
Yeah, but it's quite advances that are made to identify, because all of a sudden a baby starts crying and they don't know what they're crying about, so they give them their bottle, thinking that's going to quiet them down, and it doesn't quiet them down because they're having maybe symptoms of even sickle cell.
Yeah, and that's unfortunately that used to be the way diagnosis was made of sickle cell anemia. Why do we screen for newborns though? Because you can change the course of the disease if you diagnose it early.
Okay.
And the reason sickle cell is on that list of diseases is that infants with sickle cell used to die of infection because I mentioned their spleen goes early, and the spleen normally protects from infection.
Yes.
And over the years, people realized that if you get penicillin starting by 4 months of age, twice a day, every day, you can significantly reduce the risk of dying from, it's called pneumococcal sepsis, as an infant with sickle cell disease. Now we have vaccines too. Everybody gets vaccinated against pneumococcus.
Oh yeah,
and we still give penicillin prophylaxis.
Uh-huh.
And so infants are living much better, much longer
Oh, yeah.
with sickle cell anemia, in large part because they're found on newborn screening, they're discovered, they're diagnosed, and then the Department of Health lets doctors know, and the addresses, the phone numbers, and we go out and try to find them and get them in and start them on penicillin.
Well, you know, when you think about it, nutrition also is so important in these kind of conditions. Junk food can do more damage to some of our folks who might just have the trait, for example, you know, all the things that are in African American communities when you look at some of the diets that are happening at the present time, are the local stores that sell all the kind of foods that have all kind of chemicals in it, you know. So I think that looking at the child from that perspective is certainly important from the diet to assist the medicine. Medicine does one thing, but keeping the body healthy is another.
No, I mean, certainly it's important for everybody, and particularly for people with sickle cell disease or any underlying condition to stay healthy. I don't do such a good job with that myself, and so I don't preach a lot about diet.
Right.
But a nutritious diet has to help anybody. I've been told by people with sickle cell who come from the West Indies that they think that yams are important. In fact, yams have a chemical in them that in the lab can help reduce sickling, and I don't think you get enough in your body from a yam to actually impact on the sickling process. But there probably are foods that help a bit, but I think generally it's just good nutrition.
Well, you know, I tell you, when you think of Linus Pauling with vitamin C, for example, ships, when they would go on voyages around the world, halfway around the world, all the seamen and folks would get sick, and they would start bleeding from the gums and things like that, and lose them. And they found in one island where this didn't happen that they ate a particular type of fruit that was heavy in vitamin C. And because we know that vitamin C deficiency gives you all of these kind of maladies of swollen gums and things like that. So vitamin C is still high on the list of at least eating properly. You know, you just can't eat the junk foods and things like that, all these chemicals that are laden in junk foods. We don't know what it's doing to the body, sulfites and all these kind of things. And sulfites is in everything. And we found out sulfites, of course, cause asthma and all these other conditions. And these colored candies that the children eat are loaded with sulfites and things like this, you know. So diet is going to be very important. The drug that you're taking, which Dr. will explain to you, it's important for you to keep the soil. Keep your soil good also, S-O-I-L, as well as S-O-U-L. But the soil, you are the soil. Continue, Doctor.
Well, I don't know. We've, Tiara talked about how horrible pain is, and mentioned that after 2009, I guess that's when you started taking hydroxyurea, you were well for 3 years. And then you said it, and I don't know if I'm allowed to refer to the last show, but we talked earlier about having to hold off on college because you had bad pain for a month. You want to elaborate on that a little bit? What happened? How come you got so sickled there just as you were starting college?
I mean, honestly, it could have been because of the weather. There were days where I just didn't follow up on my medicine like I was supposed to, and I guess that, you know, really caused it.
When you say medicine?
And the hydroxyurea.
Oh, I see. Well, you didn't take it like you should.
Yeah, like I was supposed to, and I guess that really what like caused me to start getting sick a lot during my first semester.
Are you taking your medicine on a routine basis now?
Yeah, I take it every
Is it very expensive?
No.
Medicine?
No.
The prescription is usually filled through Medicaid or what have you?
Metro Plus.
I see, right. But you are taking your medicine on time and things like this now. Since you've been taking the medicine, have you felt better?
Yes, I do feel better. A lot better, like, than last semester. There's a big difference.
Right. So you don't just take your medicine when you're coming to see the doctor, do you?
No.
See, because the doctor will say, "Do you take your medicine?" Yeah, I just took it. And I haven't taken it for the whole month.
No,
I
like
haven't
they
seen
do
you.
like my blood results, so they know if I'm taking it or not. It's
Oh,
yeah.
Okay. Yes.
Because we expect to see changes in the size of the blood cells.
Mhm.
We like to see the hemoglobin go up. We like to see the fetal hemoglobin go up. And the white count is supposed to go down. So we get a sense of how effective the hydroxyurea is working. We have problems, though, if people don't tell us the truth about whether they're taking it or not. We get
Right.
confused. Should we raise the dose? Are they taking it or not taking it?
Sure.
It can be difficult. So I think TR has had an epiphany that life is better with hydroxyurea.
Oh, that's good.
And I hope we'll continue to do that. And I actually hope that her being here and having had this epiphany might help some other people on the fence out there to make that decision too. Do you want to say what worries you or what the problems are with taking hydroxyurea?
Oh, well, I know that one problem is like it's supposed to be like hair loss because, I know a lot of like like patients who have leukemia also take hydroxyurea to treat it, but I know hydroxyurea, like the side effect of it is like it's supposed to be hair loss. I read on the pamphlet on the actual like medicine bottle. It also said like you gain weight
Oh,
and
I
stuff
see.
like that.
So side effects, you think gaining weight is possibly one of the why you're gaining weight?
I mean, it could be like
Like,
I know it's
I
because
you
of
don't-
me.
I know you don't eat a lot. I know you don't eat a lot.
No,
I know
no.
you don't like ice cream and cake and all that.
I
stuff.
do like that stuff, but I know like it's something that adds to it just like a little bit. I
Yes.
mean, me if I like when I change my lifestyle, yes, I will lose the weight and everything, but it's not like that bad.
Right.
But I know that it's definitely like adding to it.
All right. How old are you now?
18.
18. And well, seriously, something's doing something in your body to make you look as healthy as you do. And if you're doing the right thing by taking your medication, that means a whole lot
Yeah.
to having a normal adult life as well. Because it took a long time to get to this level conclusion that a medication without anything else can possibly change your whole view of life and such. Yeah.
Can you think back about why you stopped taking hydroxyurea? And I'm glad that I'm not glad you had pain.
Yeah.
But I am glad that you've started taking it because, as you've heard, I think it's good for everybody to take. for a
Well,
long
it was just
time.
some nights where like I was supposed to take it and I ended up going to sleep. So I just wake up the next day like, oh, I didn't take my medicine last night. Or it was times I was studying and it just like pretty much slipped my mind. Like, yeah, I know I have the medicine, but you forget things. So it's just
But
like,
you
okay.
didn't forget eating ice cream or anything, did you? Not from what you.
No,
I mean, 'cause you look very healthy.
I'm not really an ice cream person.
What do you like as far as sweets are concerned? How about chocolate, dark chocolate, light chocolate?
Oh, I don't like.
Do you drink coffee?
Yes.
How much coffee do you drink a day?
Oh, I don't drink it very often. It's just like when I have a taste for it, I will drink it. Like,
All right, but there's not one. Is there any one particular type of food that you associate that you like to eat?
I love McDonald's.
McDonald's. Oh,
What do you like there?
Huh?
What do you eat at McDonald's?
The Big Mac.
what's
I
that?
can't blame you.
The Big Mac.
Well, let me tell you about.
I was
That's
in
okay.
South Carolina a couple of weeks ago, and we had lunch at a diner there, and they had diner-made, homemade butterscotch pecan pie. Did you ever hear that?
Yeah, it sounds good.
It's delicious. I'll tell you. So I'd be in a lot of trouble if I had that around all the time.
But getting back to diet, seriously, if you go through the whole Bible, Shadrach, Meshach, and Abednego in the book of Daniel, they were some Jewish boys that were brought to the king of Babylon to be trained as servants. And the king said to them, he said, you can have anything on my table as well. No, in fact, you can eat off my table as well. So Shadrach, Meshach, and Abednego said, all we want is water and bread, as such. That's all. And they said, you must be crazy to have to work like this and just drink water and so forth. And of course, after a period of time, they were the brightest and the healthiest of all the people that were working for the king as such. What's called a Mediterranean diet, where fish instead of meat is all the vegetables that God has given us, the colored vegetables, the peppers and the onions and things like that, have been proven to give your body the kind of it needs to grow on. It can't grow on just sugars and things like that, you know. So I would suggest that you read the book of Daniel and see what Shadrach, Meshach said. But it's called a Mediterranean diet. And if you go into the internet and look at what it is, it might give you all the food that you would like as well, but it will do your body good. So it's no joke about keeping keeping his body healthy while you're taking the medication, because medication might not do the best for you if the body is weak in certain things.
Tiara looks like she's really paying attention to this. Could be another epiphany, right? Possibly.
Yes.
I need an epiphany too. I can't seem to do that. But
Well,
I think, could I just, I don't want to make it uncomfortable, but there's so many people that I've been, again, using hydroxyurea for how long, 25 years in kids, and it seems that people are so well for so long, and then for some reason they stop. Usually that's actually adolescence, and there are a lot of issues at adolescence, but I don't know if it's that you are feeling so well and you begin to wonder whether you need the medicine, or, I mean, you say you forget, but you have a cell phone. I think I've offered to record an alert for people with their cell phones if they want to set it for 8 o'clock every night and say, don't forget your hydroxyurea. It's not forgetting always, but it just frustrates me because sometimes they don't have an epiphany and they continue to have pain. And it's really, I can't think of another word besides frustrating, but I feel so bad that I remember how well they were, and for some reason they don't, or it's not worth taking a pill every day, or a few pills, to be well again, most likely.
Oh yeah, and you really have to consider at your age and so forth. You have a life that you want to get married, you want to do a lot of things, you want to go to school and things like this. It's all dependent upon all the research now that's been done that this medication can possibly give you a new lease on life. But you got to support the body itself to be healthy, whether it's rest, whether it's not anger and all these other things that cause you to have the body to explode with other negative things in it, So I'm glad to have you on the program with Dr. Miller here, because I know he is concerned about you to be seeing you survive for a long time, So
Except that she's going to be a lawyer, I'm a little bit iffy.
well, I can tell you, she sure looked like she could tackle anything she wanted to tackle, and I think you got it up here. So if you want it up here and you want it down here and you want it to live as comfortable as possible without having crisis, then if you go ahead and take your medication, you might find it to be very true long after we're gone. Like you say, I remember going on that program and I made a plea that I will, to myself, that I will treat my body like it's somebody. Because I say, first you got to walk like somebody, then you got to talk like somebody. You got to act like somebody going somewhere. Got to smile like somebody, act like a child of somebody, and let everybody know that you can. Even a mouse became somebody. He frightened everybody because he refused to think that he was small. He decided in his mind that he was one of a kind, and from that day he's been 10 feet tall. So first you got to walk like somebody. Dr. Scott, it's so good to have you on the program. It's so good to see you. And,
thank you, Tiara, for coming on.
Coming on the show, and he'll never have to ask you, do you take your medicine? Because he'll see just from what he doesn't have to see you maybe once every couple of months instead of every month. In a sense that you're doing the right thing by yourself,
Tiara could still smile when she was in pain, I noticed, but it took a lot of humor to get her cheeks up.
Well, I'll tell you, it's nice having both of you on the show today. And to you folks out there, don't forget, research is so important. And support of research to the politicians out there is so important. On the federal level, state level, community level, to have adequate monies to do the research that we're doing here at Downstate Medical Center on such a condition such as sickle cell anemia. That's only one of the things we deal here, and we have great response from the community that we're serving here at Downstate Medical and Kings County Hospital, and all the things that scientists, with those nights that they stay out wondering what's the next best thing for patients to live a normal life. So you promise now, you promise you're going to do what.
Yes.
All right, because I'm going to bring you back on in a month's time,
Oh, look at that.
and we're going to tell you if you had any crisis, and you're going to tell the truth.
Okay.
All right.
Okay.
And thanks so much
thank you.
for that
Yeah.
research that you do,
Right.
man, you folks out there. And so, this is Dr. Deas. We'll see you the next time.